Hello, I'm Michael Posey, editor of Pharmacy Today with the American Pharmacist Association. Today I'm with Brian Gallagher, Senior Vice President of Government Affairs with APHA, and we want to talk about opportunities for the pharmacist in the new healthcare reform law. Welcome, Brian.
Glad to be here.
Medication therapy management, or MTM, has been APHA's battle cry for several years now. Does the new healthcare reform law support MTM, and what will it pay pharmacists for providing this service?
This is really one of the most exciting things in the whole legislation for pharmacy. MTM has an opportunity to become a serious reality for pharmacy now. So for all the things that we were talking about, Michael, when you and I were in school, we were talking about it way back then. We won't say how long ago that was, will we? But for all this time, we've been trying to get MTM to be reality and pharmacists to be a real serious member of the healthcare team. This is our opportunity.
And do you think pharmacists will get paid for MTM under the bill?
There's provisions to get paid for it, and a lot of provisions to improve the Part D plans that people have heard about now that we already get payment for. But yeah, there's an opportunity to do that. There's a lot of opportunities to test new models, and the goal being, a lot of people get it that MTM works, but the whole idea is to test these new models to not see whether MTM works, but to see how MTM works best.
And I know the new healthcare reform law has a lot to do with innovation, and they want to test various models of innovation. So I guess there's an innovation center that pharmacists need to be paying attention to. What is that about?
Well, this is probably the most important part of the bill for pharmacy, because it created within the CMS, Centers for Medicare and Medicaid Services, is an innovation center, and it's funded. It's funded to the tune of $10 billion, and that's billion with a B, over the next 10 years, to fund grants and contracts to try new innovative approaches. Here's the perfect place for pharmacists to get in the game. Go out there. We need to show these innovative healthcare delivery systems, how pharmacists can increase their return on investment, how we can save money, and how we can help improve access and quality, which is what Congress was trying to do.
Another term that we hear about in healthcare reform is integrated care models. What are those?
Well, an integrated care model is a complicated way of just basically saying teams. What Congress wanted to do was have teams blur the lines, have teams work together, teams of healthcare providers to provide the best care that they can for a patient. So anywhere you've got a team of people working together, that's a type of an integrated care model.
And so what do medical homes and accountable care organizations have to do with that? Are those types of integrated care models?
It's a great question. Medical homes are a type of integrated care model, because in a medical home what you have is you have a primary care physician that's coordinating the overall care for the patient. So the patient comes in there, and you can have physical therapists, you can have pharmacists providing MTM, you can have specialists, all of those things coordinated by the primary care provider. So again, blurring the lines to render the best care for the patient with the most appropriate person in there. And it's a beautiful spot for pharmacists to be able to provide MTM. Accountable care organizations are a different thing. What an accountable care organization is, it's really a payment model, a financing model. So it's based on shared savings. The idea being that if you render good care for the patient and you save money, the government gets to keep some of the money that's saved, and the providers that do a good job in efficiencies get to keep some of the money. So it's a win-win for both sides. Can an accountable care organization be a medical home? Yes, because the medical home is a delivery model. The accountable care organization is a payment model.
Interesting. For people who want to follow what's going on with healthcare reform within APHA's resources, where can they turn?
Government Affairs section of Pharmacist.com. It's a great resource. Another place is the hub on policy and advocacy in Pharmacy Today.
Very good. Well, thanks for joining us today, Brian, to talk about opportunities for the pharmacist in healthcare reform.
My pleasure.
Be sure to look at other videos in this series available in the healthcare reform section of Pharmacist.com. Thank you for joining us today.